Hi, I'm Priyanka and welcome back to ClassMonitor YouTube channel, which is one-stop solution to all your parenting concerns. It's that time of the year again, winters are hitting and children are catching cold and cough more than usual. If your baby is under the age of 1, they may catch 6 to 8 colds in a complete year. And if they go to a daycare, they may be exposed more to cold and cough. If your baby has got a cough or cold, it may be virus infection in their nasal or pharyngeal passages. The obvious signs of a cold are runny or stuffy nose, and your baby may be in a lot of discomfort and they need your extra love and attention. Now let us understand the symptoms of a common cold. Obvious one is nasal congestion followed by coughing, sneezing, loss of appetite, irritability, loss of sleep, inactivity. It may also be followed by fever and difficulty in breathing. Now that we know the symptoms, let's understand the causes of common cold. There are around 200 viruses that are responsible for common cold, and rhinovirus is the most prevalent one. As the babies are continuously exploring their surroundings with their hands, they are susceptible to get this virus through their hands, entering their body through mouth, eyes or nose. Over the time, your baby will develop immunity against these viruses, but the immunity is not long lasting, and as there are a lot of variety of these viruses, they get frequently sick due to common cold. I know we are extra cautious with our newborns, and new moms get panicked easily seeing their babies in discomfort. And although common cold can be easily treated by home remedies, which I will discuss at the end, but if your baby is under the age of 3 months, I would definitely recommend consulting a pediatrician at the earliest to rule out any serious illness issues. And if your baby is older than 3 months of age, you can observe for 2-3 days, and if the condition doesn't improve or there is a fever, immediately consult your pediatrician. Apart from it, there are some indicators that you need to look out for where you need to seek medical help immediately, which are when the baby refuses to nurse or accept fluids. Secondly, if they cough up and it leads to vomit. Third, if they cough and there is blood-tinged mucus. Fourthly, baby has unusually low energy and is very sleepy. And lastly, has difficulty in breathing. We can be better prepared to prevent common cold if we understand how it gets transmitted. It has 3 ways of transmission. First is via air, direct contact, and third, contaminated surface. The virus gets transmitted through air when another person having cough or cold sneezes, coughs or speaks in front of the baby. Second is direct contact. If a person with cough and cold picks up the baby or touches the baby, your child is at risk of contracting the illness. Young children are very frequent carriers of the same. And third is contaminated surface. The common cold virus survives on hard surface for more than 2 hours. So if a toy or something that a baby touches is contaminated with germs, your baby is likely to get it. Now that we understand the transmission mechanism, let's understand some preventive guidelines. The common cold cannot be prevented using vaccination. It requires good old-fashioned hygiene practices, including washing your hands frequently. Now let's list down some of the preventive steps. Protect your baby from any infected person. If any of your family member or any visitor has cough and cold, tell them to be at distance from baby as they catch cough and cold very easily. Avoid taking your newborn in public transport or in large crowded gatherings. Before contacting or feeding the baby, wash your hands with a soap for at least 20 seconds. In absence of soap, use 60% alcohol-based sanitizer. Always instruct your older kids to wash their hands after using washroom and not touch their dirty hands to their face, nose or mouth. Instruct the members of your family to cough or sneeze only in tissue and dispose that tissue followed by washing hands. And in case the tissue is not there, they must always sneeze or cough in their elbow followed by hand washing. Lastly, if you're planning for a daycare, choose a daycare that has strict rules for keeping the kids at home if they are ill. of treatment and I'll list down some home remedies too. But before that, if you have any useful home remedies, don't forget to punch them in comments. Now coming to the course of treatment, it is always advisable to consult your pediatrician for any of the medicine prescriptions. Never listen to advices of other people about how much dosage or a spoonful of any medicine. Always consult your pediatrician because the medicine is given according to the weight of the baby and how much serious the issue is. So get the medicine, dosage and number of days of treatment prescribed only by a doctor. Now there are some amazing home remedies that you can follow along with what your doctor has prescribed. So now let's discuss those. But before starting with the list, I would definitely like to know what are the home remedies that you follow for your baby. And also, if you haven't subscribed to our channel until now, please do so. The first one is that for breastfeeding baby, mothers should drink plenty of water and stay hydrated. Breast milk is white gold and builds immunity, and if mother is hydrated, breastfeeding becomes very easy and natural. And even if you are not a breastfeeding mom, keep feeding formula milk to your baby frequently as staying hydrated recovers them very easily. Use suction bulb to remove any kind of thick mucus that is in your baby's nostrils. It can also be followed by saline drops. Nextly, steam works wonders. All you need to do is hold your baby in your lap and start the steamer. It helps in recovering very fast. Another tip is that there is a separate baby vapor rub available in market. You have to apply very little amount of it on their clothes and the bed and not directly on their skin at least until they turn 1 year of age. You can also moisten the room using air humidifier. Another useful tip is that roast some ajwain seeds and tie it up in a potli and keep that potli near your baby while they are sleeping. And if your baby has started with solid, soups always help with faster recovery. Lastly, if nothing works, nebulization always helps. Consult your doctor and nebulize them regularly. Hope you have a clear idea about common cold and cough now, from symptoms to causes to preventive steps and home remedies. I hope this video was helpful to you. Don't forget to subscribe to ClassMonitor channel for more such information. Also, if you have any queries, we would love to get back to you on that. Just ask your queries in the comment section.